Hi, this is Sarah Gilbert with Transitions Therapy LLC in Manchester, Connecticut. I want to talk a little bit about what you can expect at your first therapy session because that's something that might be creating so much anxiety and overwhelm for people that they may be perhaps thinking that they want to reach out for help, but they're really afraid to do so because there's a lot of unknown. So what I want to do today in this video is just chat for a few minutes about the process someone goes through when they are starting to work with me. And even if you and I don't end up working together, I'm hoping that this video helps provide some useful information because I do think that in general there's a lot of similarities between various therapists and how they handle this initial part of the therapy process. So I hope this is helpful for you. So when someone's looking for therapy, the first step with me is that someone usually will call me, sometimes email, but most of the time people will give me a phone call and let me know that they're looking for therapy. And so what I do is I make sure that we have a few minutes to chat to really talk about what's going on for someone, why they're calling me, what kind of things are going on that basically led them to reaching out for help from an outside professional. For me, typically, that initial phone call is anywhere between 10 and 15 minutes. I want to be able to give people enough time to explain what's going on in their lives, what's a struggle, maybe what they're afraid of, and also to be able to answer any questions, and obviously to give the people who are calling me a chance to ask me any questions if they have any. And so from there, if we both decide that we're a good fit to work together, I will send someone an email link to the client portal for the electronic health records that I use. And through there, people can read through all my documents, all my policies, fill out the information that they need to facilitate insurance claims, information being shared, all that good stuff. I like to do things that way because I like to devote all of my time at our first session to really diving into what brings them to therapy rather than spending a lot of time going over and signing paperwork. So after that, all that paperwork is signed electronically, then the next step would be us meeting face-to-face at the scheduled appointment time. So the first session is one in which I'm going into more detail about what brings that person to my office, what helps them cope better. Maybe there are some things that they're already doing that's really helpful. I want to know that, as well as what the current struggles are. So we'll talk a little bit about, your past as well, but mainly I want to focus on what's going on for you right now. Where do you see things are maybe not as good as they should be, or not as good as they used to be, maybe not as easy, ways in which you want your day-to-day experience to change, and what goals you're working towards. So it's a lot of information gathering as opposed to a traditional therapy session where we're working on some strategies and processing some things. That initial intake appointment is really all about gathering information for the most part. And when working with me, I'm very cognizant of the fact that you and I are just talking for the first time. You've never even met me before, and some pretty personal stuff's going to come up, right? I mean, why else are you going to therapy if you don't have some really personal things to discuss? So I always want to make sure that the people that I'm seeing know that if there's anything that's maybe too uncomfortable to talk about, if there's anything that maybe you're not ready to tell a perfect stranger yet, that's completely fine. It's totally understandable that maybe there is something you want to get to, but maybe you don't feel comfortable that first time we're talking. That's great. Just let me know that, and we won't go there. It's totally fine. There's nothing to be worried that I'm going to be upset about. I want to make sure that you are feeling as comfortable as possible in our process of working together. So feel free to let me know that. So that's basically it. It's a lot of information gathering, finding out where things are for you right now, maybe where they've been in the past to kind of compare, and also looking at where you want things to be in the future, how you'd like life to be perfect. Basically, what I want to find out is, how do I help you get to the point where you don't need to see me anymore? I know some people find that strange, but that really is kind of what guides my work. Is I want to try to help people have the answers and the skills that they're seeking so that they're feeling empowered to go about their days and lives beyond the therapy process. So I hope that helps answers any questions you may have. If you have any further questions, like I said earlier, please leave a comment below and feel free to ask any questions, or you can reach me through my website, which is www.transitionsTherapyLLC. That website provides a lot of information about my practice as well, and there's also links where you can email or give me a call through that website. Take care. Bye.